Welcome to Balls Deep, a humorous yet informative medical show with a mission of optimizing your performance in the bedroom, the bathroom, and the boardroom. I'm your host, Dr. Joe Pizzona, a board-certified urologist and CEO of Pizzona MD. We hope you enjoy. Now, let's jump right in. Hey, Stream Team, Dr. Joe Pizzona. We are back again, doing a double episode here. While I got my wife out of the house, I figured let's go ahead and let's just hammer this out.
Well, I have a hard time getting around right now.
Yeah,
it's tedious.
Yeah. And after this week, you may not be back. So I was like, we've got you in the chair. We're not going to move you until we at least record 2 episodes.
Okay.
So.
Yeah, I got to work with the crutches. There's a lot of scooting involved, and I fell over a couple of times. So.
Yeah. You've been pretty good, though. I mean, you're naturally clumsy. I think we covered that before, that despite being so elegant and training in ballet, like you can do all these beautiful yoga poses, but yet you walk into walls and tables that
That's why I didn't get the scooter. That's why they offered me the knee scooter, and I was like, no, this is very dangerous.
That would have been pretty awful.
Disaster. So forget that. I am alive, and I am okay.
That you are. Well, what do you want to talk about now, Kat?
I wanted to take today's episode to talk about something that I think is pretty important, prostate cancer.
Yeah, definitely. I think this is a good one to, boy, we could talk hours about prostate cancer and each little facet, but God knows you don't have the bandwidth and we don't want to keep people bored here.
We'll hit the highlights.
We'll hit the highlights because honestly, you don't listen to half the stuff I say anyway.
I don't.
Let's do like a 30,000 foot view of prostate cancer. I'll do my best to be as... Succinct. That's the word. So, I was going to say verbose, but that's the exact opposite.
That's completely wrong.
Yeah,
no. Medicine, not English. It's not his thing.
This is called, this thing woke up at 3 a.m. again and did not go back to bed.
But generally, English is not your subject.
No, not at all.
Definitely a person who will often end a sentence with a preposition. Ooh. Oh, killing me.
My favorite is when you
medical school degree.
Well, I don't have time to remember that shit. I mean, like, honestly, there's
third
grammar.
grade, man. Dude, it was third grade.
There are grammar rules you're teaching me. I'm like, yeah, I've never heard of it.
Never heard it. We'll continue to work.
Somehow got through Northwestern and never once learned that rule. So, like, whatever.
Shocking, because Northwestern said no thanks to my application.
Now, the good news is, like, today's generation, they don't even speak English or in full sentences. They just use abbreviations and like grunts and bruh.
But we are off message. We will bring it back to prostate cancer.
Yeah, if we spend time talking about all my limitations, we'd be here a while.
It'd be a long episode.
Yes, that it would. Well, you don't have to agree with that, but let's stick with something I do know. So prostates.
Okay, about that time.
Balls deep.
Prostate cancer. What is prostate cancer? Can you just tell us briefly what it is? I mean, obviously it is a cancer, but a little bit more detail.
Yeah, so prostate cancer, I believe, is the most commonly diagnosed solid organ cancer in men. So, you take away things like skin cancer. And so the prostate, if we remember from our enlarged prostate episode, is kind of a golf ball, small plum-sized organ that's part of our urinary tract and reproductive tract in men. Sits right behind our pubic bone below the bladder. And like most parts of our body, you live long enough and these areas can develop cancer. And so the unique thing about prostate cancer is that it rarely causes symptoms. So
at all,
yeah. So
you could have had prostate cancer for months, years, and never had any symptom at all. At all?
Yeah, that's the most common way we diagnose it is zero symptoms. In fact, by the time you get symptoms from prostate cancer, it's pretty far gone. So, a lot of guys come in and see me because they've got some pain down here. They have trouble urinating, or they urinate blood, or there's blood in the semen. Those almost never are due to prostate cancer. So It is a relatively slow-growing cancer. And so that gives us an opportunity to screen for it, meaning let's try and detect it before it's too late. Let's detect it before it causes symptoms. So we know that, say, for breast cancer screening. We do breast exams and mammograms and maybe some MRIs, right? Before you find that lump. And then for colon cancer, you screen that with a scope in the bottom and the new favorite poop in a box and send that away, right?
I don't know that that's anybody's favorite, but whatever you say.
We were talking
The
about
Cologuard, the poop in a box.
Were we talking about this last week? Like, I want to be like the guy in the factory. Like, sorry, sidebar, but I think this is pretty funny. Like,
this is what we talk about at our home.
It really is. We're pretty sick. So, but like, I want to be like the supervisor who's like training the new Cologuard person, like in the factory, and be like, all right, so come over here. So this is where the boxes come in. And then what you do is you open the box and then there's the poo. Like,
whose poor job is this?
Like,
you work with the box of the poo.
I mean, I gotta
don't sign up for this job.
No.
Terrible.
And I gotta hope like there's not like you don't put a big load in the box. Like I've never done this myself, but
wow.
Yeah, these are the things I think about in my off time. I'm like, hopefully it's just like a little smear or sample. But
men and their thought process and their conversations, even men who are doctors.
Oh, wait, hold on. We went down some rabbit hole off air on this.
Don't throw me under the bus. This is you. This is all you.
We can get a little creative with how those samples come in.
You're a very nasty person.
Well, listen, I look at penises all day. That's a given.
Fair.
So, I'm sorry, back to prostate cancer.
But you
Forget
get a
about poop in a box.
colonoscopy if you are checking for colon cancer.
Correct. So what
you
do
get a mammogram for breast cancer. Mm-hmm. So what do you do for prostate cancer?
Great. So we're back on track.
We're pulling it back.
You're pulling it back in. So for prostate cancer, we have screening tests as well. So the dreaded one most guys think about is this. Right?
The finger. He's giving the finger.
The finger in the bottom. Yeah, the urologist finger.
Yikes.
And still a part of our tool belt for looking for it. And now, a couple things to know.
The finger is really the tester?
It's one of them.
It's
for
one
sure.
of, okay.
So a couple things that the public should know. Number one, most prostate cancers are not felt on an exam. So although we do the finger exam, it is not going to catch all cancers. Not just for fun.
No, okay.
Number two, we had a lot of jokes based on our finger exams here. We'll keep it PG, or maybe I'll be a little loose-lipped a little bit later. But we are talking about poop in a box, for God's sake. I mean, I might as well go for it. Number two, it's unclear how truly beneficial it is to do that finger exam. So again, because most of the cancers we find via the second thing we'll talk about, unclear utility, honestly, in 2024 to that finger exam. So even some of us urologists are going, how necessary is this? So lastly, if you are going to get it, pick your urologist by the size of their hand. This is not time to go to the urologist with the big, sausage fingers, because it's certainly not comfortable.
Jump in the shark, Pizzona. Jump in the shark.
Well, I mean, listen, you don't know anything else about me. Where I went to school, you saw my picture, like how big is my hand? So I'm going to pick my urologist.
It's a fair question.
Yeah.
It's a fair question.
So if we're saying finger exam, unclear benefit, the other one is a blood test. So PSA, that stands for prostate specific antigen. Fancy doctor terms, if we work backwards, a protein made specifically by the prostate. Antigen's a protein. And so this is very specific to the prostate. In other words, if you don't have a prostate, you really don't make PSA, at least what's detectable by most lab tests or assays. Now, there are some ultra sensitive PSAs that can detect a PSA in a woman, that can detect a PSA in a young child or a man who's had his prostate removed. But when I'm talking about the blood test, you got to have a prostate for this to be detectable. And back in the late 80s, early 90s, we just said, hey, the cutoff for a PSA blood test is 4. Everything before 4 is, quote, normal. Everything over 4 is abnormal. Go see your urologist. And so, all right, makes sense, right? Just check your blood test. If it's low, you're good. And if it's high, then go get checked out. Well, a lot of caveats and things that come up with this. So first off, PSA rises with age. So if your PSA is 3 and you're 52, way too high. On the flip side, if your PSA is 5.2 and you're 86, probably doesn't matter. Okay. So there's some age related to that. Speaking of age, we screen at different times. So
When would you start screening for
again,
this?
lots of controversy because, and I'll get into the inaccuracies of the PSA blood test and things that have come up. I like saying you should start at age 50 at a bare minimum. I got mine checked in my 40s. I think if you have a family history of prostate cancer, if you're African American because of a higher genetic risk of prostate cancer and a more aggressive cancer, absolutely get a blood test checked by age 40. Now, you can go on a lot of these different, society websites and look at these guidelines, and they have these, to me, what are ridiculous guidelines. Like even the urologists are like, you should only screen with PSA between ages 55 to 69. How'd they come up with that stupid age range? Well, they ran some studies, and for anyone who knows a modicum of statistics, and a modicum's about all I know, if you break up things into enough different groups, you'll find, quote, statistical significance. And that's the age group they found that PSA is, quote, most beneficial. So therefore it goes in the guideline. But it's absurd. That means you're going to tell a 54-year-old that he doesn't get a PSA when I've diagnosed it in men with family histories at age 38. And that I'm not going to go get a simple blood test in my 40s. You're crazy. And on the flip side, although it's slow growing, you're going to tell a guy who's healthy and 70 and runs marathons and eats really well, he can't keep screening for prostate cancer. Again, until we get to socialized medicine, which I hope we don't ever get to, whole other topic. I'm not real big on these population-based guidelines, so really what does it come down to? An informed decision with your doctor. You decide with them based on your risk factors, your other health conditions. But if it's me, if it's a loved one, I'm starting in my 40s. If it looks good, I'll check it every couple of years and then go back to it at age 50.
Okay, so there is a blood test, but does the blood test diagnose prostate cancer? Is that the only way to diagnose that you do indeed have prostate cancer? That's it?
So great question. So the PSA does not diagnose prostate cancer. It screens for it. It simply is a step. If we think of it like a flow chart, right? I hit age 50, check a PSA. Is it less than 4? For argument's sake, yes. Okay, you're good. It's over 4. Go see a urologist. But by no means is a diagnostic of cancer. And this is where the controversy has come in. So again, if you look at the fact that a PSA can be elevated for other reasons, say an enlarged prostate, a prostate that's inflamed, genetics, no darn good reason. I got some guys whose PSAs are like double digits or in the 10s, and I've biopsied them a bunch of times. We've followed them for years. Never find a snippet of cancer. It's not there.
Okay.
And then you have other guys with really low PSAs who have cancer. So what happens then is you take that scenario where you get inaccuracies. You couple this with prostate cancers can be very slow growing. So from the time of diagnosis, it may take 10, 20 years for that cancer untreated to hurt someone. All of a sudden you start raising questions with these statisticians going, is this blood test really worth it? We don't think so. Don't check a PSA. And so that happened. There was a task force with the government who decided that PSA got a D grade on their rating. And so we stopped PSA screening. The urologist didn't, but a lot of primary care docs did for a number of years. And you want to know what happened? We saw a steep rise in really aggressive bad prostate cancers many years later. So again, we're talking about a blood test, people. With all the trillions of dollars we're spending in healthcare,
It's fairly simple.
It ain't the prostate cancer blood test that's leading to healthcare costs. Now, you can argue that if you check the blood test and then you get diagnosed with a cancer that's maybe not that aggressive, that then you get treated unnecessarily, that's leading to unnecessary healthcare spend. But that's so far down the algorithm. So we're going to eliminate screening a preventable cancer. a cancer we can cure for everybody because we're worried about that scenario, that just doesn't make sense to me. So,
But for us, not me, but the patient who has done the screening, they've done their PSA, they're talking to their urologist, they do find some evidence of prostate cancer. How do you know? You said it's can be slow growing. It's not always something you have to treat. How do you know when? When it is treatable? When is the moment it needs significant attention?
yeah. So let me, before I answer that, go back to what your original question is, because again, there's all these tangents that are so
Sure.
related, and that's why this is such a complex topic. So again, the PSA doesn't diagnose it. So let's go through real briefly that scenario. It is elevated. I've got a couple tests from DNA urine tests to MRIs that are the next phase of testing.
Okay.
So if you're high and I go, I'm a little worried, let's do this. And if those tests are negative, I may just go, hey, we're just going to watch this. If I'm concerned, we will then head to the true diagnostic test, which is a prostate biopsy. We could do a whole episode on prostate biopsies. There's lots of ways to do them, but bottom line is it's typically a quick outpatient or office-based procedure where we got to get a tissue diagnosis. Like to know for certain it's cancer, we got to get a piece of tissue, put it under a microscope, say, hey, pathologist, is this cancer, yes or no? Okay. So we're now at this phase. I've got a man sitting in front of me. He's got prostate cancer. What do I do? So this is where we combine patient factors and cancer factors to guide my 45-minute discussion with a patient at a minimum. So it's very, very nuanced. So let's start with the age. If I have somebody who is older, so let's say 70 plus, if someone's got a lot of medical issues, diabetes, obesity, they had a heart attack, they had a stroke, if we believe that the odds are they're probably not going to be here within 10 years, that alone, I may just say, we're going to watch this. Because again, a lot of prostate cancers are not going to cause harm sooner than that. And the treatment may be worse than just letting the cancer take its natural course, because that gentleman's likely going to have a heart attack in a couple of years. It's a very morbid way to look at things, but it's a way that we have to, because we have to individualize the approach. We don't want to take every guy with prostate cancer and, quote, cut it out. That'd be dangerous. So we look at those patient factors. Then we look at the cancer factors. So what are the things we look at? Their PSA blood test. So although not accurate for the original sort of screening in all cases, it can be a pretty good indicator of how bad the cancer is. So a guy with a PSA of 20, I'm more worried about than a guy with a PSA of 4.3. I'm going to look at the biopsy report. That's going to be really the big one. And there's a scoring system we get that I can tell you're already getting bored and will bore you even more. It's called the Gleason score. And it's not named after Jackie Gleason, but it's named after a pathologist who came up with this kind of very odd scoring system. But bottom line, he's looked under a microscope and said, those cancer cells look aggressive. Those don't, and give us a score. So I sit a guy down and I say, hey, you've got a Gleason 6 prostate cancer. We're just going to watch this. Or I go, you have a Gleason 9 prostate cancer. This is aggressive. Actually, before we talk about treatment, I got to go do some tests to make sure this thing hasn't spread microscopically. And we do PET scans and bone scans and CAT scans. So again, a lot of details. But bottom line is, a good urologist is going to look at patient factors, cancer factors, and then give you their opinion. First, treatment versus no treatment. And then if we're talking treatment, traditionally the two biggest ones are going to be surgery or radiation. But in the prostate cancer world, where there's a lot of money to be made and there's a lot of tools and charlatans and shamans and people out there, there's a whole bunch of treatments you can find on the internet and go and get from lots of different things. And so again, I think it'd be a big episode to go down that rabbit hole, and I won't even bother mention them because I'll get somebody who goes, how dare you say that? That's BS. I had it and it worked. Listen, prostate cancer, if it's going to take 20 years to kill you, I could give you a fiber gummy from Costco every day of your life, and you're going to be around in 20 years. And it didn't mean the fiber gummy treated your prostate cancer. Just meant it was a slow growing cancer and it wasn't going to harm you anytime soon. So that's the other nuance with all this, is we have all this confusion with the blood tests, and then we have all the confusion with the treatments because it can take a while to harm somebody. But the way I look at it is I want to find the guys who have bad cancers and get them in front of the right specialists who can treat it with the known appropriate treatments that we have. So 200 plus thousand men a year will be diagnosed with prostate cancer in the US this year. And, 40 to 50,000 people will die. So you can look at those numbers and go, well, geez, most people live with it and they don't die from it. And that's true, but there's 40,000 people who did die. And that may have been after years and years of suffering with that cancer. So I think another point to get across to people is just because a cancer doesn't kill you doesn't mean that it's not going to cause you significant loss of quality of your life. Prostate cancer spreads to people's bones and can cause fractures. It can, in later stages, obstruct the urine flow and lead to bleeding and catheters. It can block your kidneys. So there's a lot of bad stuff that can happen from prostate cancer and the prostate cancer treatments that you want to catch this earlier rather than later because there are windows of opportunity to really impact patients in a positive way.
Okay, that's a lot. That's a lot. I think that's a really good overview of prostate cancer. I learned something.
Well, good.
One question though, I feel like there was someone that I knew who it did seem that he passed from the prostate cancer, but it seems that they caught it late. It was undetected or undiagnosed. How does that work? Because it seems like the blood test is fairly simple. Is that just the result of not seeing your doctor or not having some yearly check-ins just to stay on top of things? I mean, is that something to get across, that this is out there, but if you stay in contact with your physician, these are outcomes, these are things that are completely avoidable. Is that accurate to say?
Yeah, I'd say for most of the cases. Now, there are
Not for all.
Yeah, not for all. I mean, listen, there's certainly some real rare aggressive types of prostate cancer, and then there's some that really just sneak under the radar and, you had some other medical issues. You forgot to go in, they forgot to order the blood test, or they listened to what the government was saying about the PSA not being useful. And then you check it a couple of years later and you go, oh my God. But yeah, for the most part, it is a relatively, I don't want to say preventable cancer, but it is absolutely a cancer we can make a big impact on early. And sometimes the big impact is we do nothing. I have a lot of guys, I just watch the cancer, but I'd rather know about it and appropriately select the guy for that active surveillance than this other idea of, oh, the blood test is useless, it's not accurate, just don't even bother checking. And then, we certainly get these guys who kind of go these alternative ways. I mean, every now and then I get these guys who they fly down to some foreign country and do these, quote, experimental therapies, or they say they're just going to put their faith in their spiritual beliefs. And again, I'm all for religion and being spiritual and using that as a adjunct. But modern medicine's here for a reason, people. And I think the good Lord put people like myself and other folks here to give good healthcare and give good advice. And so, we got to be careful of being too cynical in the society and healthcare thing. All doctors are evil and out there making money. I mean, I don't treat prostate cancer anymore. I guide and mentor people. But I leave that to the guys who are really experts in doing it, who do a lot of robotic prostate surgeries, and the radiation experts and the guys who this is all they do. So there are practices like Pizzone MD who we're there to guide you, and we're not trying to make money or, do something. And so, I want people to just get across. It's a simple blood test. There's things you can do about it, and just partner with the right physician and, have that discussion. So I look at it as a concluding statement: knowledge is power. Check the blood test. If it's appropriate to get diagnosed, know your numbers and get it, and then come to a decision. But don't just step back and say, I'm just going to bury my head in the sand and not worry about it.
I think that's excellent advice all around. Okay, let's hit my favorite part of the segment. Just the tip. So our takeaways from today about prostate cancer. Number one, most people will not die from prostate cancer they'll die with prostate cancer. Is that an accurate statement?
Yeah, absolutely.
Okay, I think I got that mostly correct.
Yeah, you did.
Okay. Number 2, a PSA blood test is a simple screening tool that every man over the age of 50 should get,
Absolutely.
and possibly even sooner.
Yep, if family history or any genetic risk factors.
Okay. And number 3, even if you do not die from prostate cancer, serious complications may occur if it is left untreated.
Yep,
Go see your urologist.
absolutely. We're here for a reason, people, right?
They are, not just to have stupid, crazy jokes. But
Yeah, no, exactly. So, yeah, I mean, I'm glad we got to the poop in the box thing too. That was
you've
a good. That was a
been
good.
waiting to talk about poop
Oh
in
my
the
God.
box.
Like, I mean, every time I see that commercial, my brain just starts going. I'm like, I just imagine some of the samples they get.
Stop.
get
You know
through
that
So-
everybody watching those television commercials is just losing it in their minds.
Absolutely.
The memes, the gifs.
Hopefully Cologuard doesn't come after us. So.
They will. They
Listen,
will. See
Cologuard-
you soon, Color Guard.
Yeah, no,
Cologuard, not Color Guard.
It's not Color Guard. Yeah, the Color Guard's not. The Color Guard comes after you. We're
Now
in bigger
the flag
trouble.
girls are coming after me next. I don't even know the difference.
Absolutely.
Oh my gosh.
Stream team, thanks for sticking with us through this ridiculous but hopefully informative episode. Welcome to Balls Deep, right? Please leave a comment, subscribe, do all the stuff you know to do. We love you guys. We want to hear more from you. And please remember that we're all works in progress. Show yourself a little bit more love and grace. These are opportunities to improve ourselves, including the two of us after today.
Very, very much. The two of us need to improve.
I don't think we will, though. I
We
mean,
won't.
We
We
have
won't.
too much fun.
Stay tuned.
Absolutely. See you, team. Take care.
Thank you for listening to this week's episode of Balls Deep. If you'd like to join our stream team of listeners, please click the subscribe button on your favorite podcast platform. For more information about our practice, Pizzona MD, please visit pizzonamd.com. This podcast is for informational purposes only, and the content is not intended to be a substitute for professional medical advice. The show does not constitute the practice of medicine. No doctor-patient relationship is formed through this podcast or any of the social media channels related to this show. The use of this information is at the user's own risk. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.